Hi everyone, I'm Dr. Juliana, and in today's video, I'm going to share with you 5 essential penis care tips that every man needs to know in order to maintain strong, healthy sexual function throughout life. And if you stick with me to the very end, I've got one final bonus tip, a small, often overlooked change that can dramatically reduce your risk of future sexual health problems. So don't miss that. Now, these aren't just random ideas or tips pulled from social media threads. They are based on real clinical experience, biological science, and the kinds of conversations I have every day with patients in my practice. If you're serious about preserving your erection quality, reducing the risk of conditions like Peyronie's disease or penile cancer, and avoiding the embarrassment of sexual dysfunction, then this is for you. And let me be clear, none of these problems appear out of nowhere. They're built over time from habits, choices, and neglect. So the sooner you start practicing these 5 essential habits, the better the chances you'll enjoy a healthy, active, and confident sex life well into your older years. Let's begin with the first, and maybe the most misunderstood principle of male sexual health: keeping the penis active. Now, when I say that, most people assume I'm talking about frequent masturbation. I'm not. In fact, we need to rethink that entire narrative. While it's true that the penis, like other muscles and tissues in the body, requires regular oxygenation and blood flow to stay healthy, the source and quality of that stimulation matters immensely. Let me explain. The penis is composed of smooth muscle, connective tissue, and vascular channels that depend on regular blood circulation to maintain elasticity and function. In the absence of arousal or sexual activity, those tissues can slowly atrophy. This is called disuse atrophy, and it's very real, especially in men who are older or dealing with chronic illnesses. So yes, keeping the penis active matters, but that doesn't mean daily or compulsive masturbation is the right answer. And this is where most advice online goes dangerously off track. The truth is, a growing body of evidence is revealing the damaging effects of habitual masturbation, particularly when it's paired with internet pornography. For example, a 2016 study published in Frontiers in Psychology found that frequent porn consumption alters the brain's reward circuitry, leading to what's called dopamine downregulation. This essentially means that the brain becomes less sensitive to pleasure over time. What was once arousing becomes boring. The user then needs more extreme material or more frequent stimulation to achieve the same effect. And yes, that's addiction. That same research linked this overstimulation to symptoms like delayed ejaculation, loss of libido, anxiety, and even erectile dysfunction. Another important study, published in Behavioral Sciences, documented how compulsive masturbation affects men's ability to connect with real partners. As fantasy replaces real intimacy, men may experience a growing discomfort or anxiety around actual physical contact. This is especially true when masturbation becomes a coping mechanism for emotional stress, loneliness, or boredom, rather than being part of a healthy, intimate relationship. There's also the issue of physical overstimulation. The brain wires itself around whatever stimuli we repeatedly expose it to. So, when a man trains his arousal response to artificial patterns, intense visuals, fast pacing, total control, he conditions himself away from the natural rhythm of human intimacy. This can result in difficulty achieving or maintaining erections during partnered sex. It's called porn-induced erectile dysfunction, and it's now so common among younger men that entire support communities have formed around reversing it. So, no, frequent masturbation, it is not the kind of activity I recommend when I say you should keep your penis active. Instead, I encourage you to focus on stimulation that is supportive, balanced, and grounded in your real life. If you are sexually active with a partner, regular intimacy, even non-penetrative touch, keeps the erectile tissues healthy by encouraging natural blood flow, hormonal release, and emotional bonding. If you are not currently in a relationship, there are still excellent ways to maintain function without relying on pornography or high-frequency self-stimulation. One of those methods is pelvic floor training. You may have heard of Kegel exercises. They're not just for women. Strengthening the pelvic floor helps support the muscles responsible for erection, ejaculation, and bladder control. Clinical studies have shown that men who perform these exercises regularly can reduce symptoms of erectile dysfunction, increase stamina, and even improve orgasm quality. Another option, particularly for men experiencing long periods of abstinence or recovering from surgery, is the use of a vacuum erection device. This isn't a sex toy. It's a legitimate therapeutic tool that gently draws blood into the penis and helps preserve vascular health. Combined with stretching, warm baths, and healthy physical movement, this is a smart, proactive way to avoid disuse without falling into unhealthy patterns. Your penis is part of your body, and like every part of your body, it needs proper care. Not overuse, not neglect, but mindful, intelligent attention. Avoiding disuse doesn't mean chasing stimulation. It means understanding the kind of activity that supports your health rather than drains it. If you're caught in a pattern of compulsive masturbation, especially with pornography, I urge you to take a break, reset your brain, and allow your nervous system to recalibrate. Thousands of men have done it, and the benefits are profound. Better energy, better focus, better connection, and yes, better sex. Coming up next, we'll go deeper into something deceptively simple but incredibly important: hygiene. Most men think they've got it covered, but the statistics say otherwise. In some countries, poor hygiene is the leading risk factor for penile cancer. So in the next section, I'll explain exactly what you should be doing and what to stop doing when it comes to keeping things clean and healthy. Now, let's talk about hygiene. Probably the simplest yet most underestimated part of penis care. You would think that most men wash properly and regularly, but the truth is, many either neglect it, overdo it, or do it incorrectly. And the consequences aren't just about odor or discomfort. In some regions, poor hygiene is one of the primary risk factors for developing penile cancer, especially in uncircumcised men. This isn't meant to scare you. It's meant to emphasize that basic care matters far more than people realize. The skin of the penis, particularly under the foreskin if you're uncircumcised, creates a natural buildup of cells, sweat, and oil. This substance is called smegma. While it's biologically normal, when not cleaned properly, it becomes a breeding ground for bacteria and fungi. This increases your risk of local infections, inflammation, and even long-term conditions like phimosis, where the foreskin becomes too tight to retract. Worse yet, persistent hygiene neglect can lead to chronic inflammation, which over time contributes to changes in the tissue that may increase the risk of malignant transformation. In other words, cancer. To avoid this, hygiene should be a simple, consistent daily habit. Gently pull back the foreskin, if present, and wash the head of the penis with warm water and mild, non-perfumed soap. Avoid using harsh antibacterial products or alcohol-based cleansers. They disrupt the natural balance of the skin and may lead to dryness or irritation. After cleaning, make sure to dry thoroughly. Moisture trapped in skin folds is one of the main causes of fungal infections in this area. And here's a point few people mention. After sex, always clean the area again. The pH of vaginal fluid is different from the pH of the penile skin, and if not cleaned off, this can alter the microbiome of the area and lead to irritation or infections. Now that we've covered external care, let's move to something more mechanical: how the penis is used during sex. This brings us to tip number 3, Avoid having intercourse with a partial erection. I know it sounds awkward to mention, but it's important. Many men, either due to performance anxiety or rushing things, may attempt penetration before the penis is fully rigid. While that might seem harmless, it can actually lead to serious damage. When the penis is only partially erect, it's in a vulnerable state. It's soft enough to bend, but not soft enough to be painless, and this puts it at risk for repeated microtraumas during penetration. Over time, these micro-injuries can result in the development of fibrous plaques inside the penile shaft. These plaques create tension and pulling during erection, leading to curvature or even pain during sex. This condition is called Peyronie's disease, and while it varies in severity, it can seriously affect both function and confidence. Sadly, Peyronie's disease is more common than most people realize, and in many cases, it could have been avoided. One of the best ways to prevent it is to be patient and gentle during sexual encounters. Don't rush. Make sure you're fully aroused before attempting penetration, and if erection strength is an ongoing issue, don't ignore it. It's a signal that your body or your mind needs attention. Get evaluated by a urologist, work on lifestyle changes, or consider pelvic training, but don't push your body into situations that increase injury risk. And while we're on the topic of pressure and unrealistic expectations, let's talk about porn, specifically the overuse of pornography, which brings us to tip number 4. This is one of the most frequent and yet most sensitive topics I discuss with younger patients. Many men today begin watching porn during adolescence, and by adulthood it becomes a daily or near daily habit. They don't see it as harmful, it's just something you do. But the brain doesn't always agree. Pornography, especially the easily accessible, high-definition, high-intensity type available today, overstimulates the brain's reward system. With each viewing session, the brain releases powerful amounts of dopamine. Over time, the brain becomes less responsive to the same material. This leads users to seek more extreme or novel content just to feel aroused. This process mirrors the neurobiology of substance addiction, and the result is often emotional desensitization, delayed ejaculation, lack of arousal with real partners, and in some cases, complete dependence on solo stimulation for release. Studies from institutions like Cambridge University and journals such as Sexual Medicine Reviews have shown that heavy porn users often experience a decline in desire, motivation, and relationship satisfaction. More disturbingly, they may not even realize the link. They just feel numb, tired, or disconnected during sex, and blame it on stress or aging. What's actually happening is that the brain has been rewired to associate arousal with the instant gratification and hyperstimulation that only porn can provide. If you recognize this pattern in your life, don't panic. The brain is incredibly adaptive, and just as it can be trained into dysfunction, it can also heal. Taking a break from porn, also known as a dopamine reset, has helped thousands of men regain their sensitivity, emotional clarity, and sexual connection. It's not easy at first, but the benefits are real. Many men report better energy, more vivid sexual experiences, and a renewed sense of desire after a few weeks of abstinence. So the message here is not moral, but medical. Excessive porn use changes how your body and brain respond to real intimacy. And if your goal is to maintain strong, natural, and fulfilling sexual experiences, this is a habit that needs to be kept in check or dropped entirely. In the final part of this series, we'll explore one of the most underrated factors in sexual health, your lifestyle. Everything from what you eat, how you sleep, to whether you smoke or sit all day affects your erection strength and hormone levels. And of course, I'll share that bonus tip, a small simple thing you can do every night that might just prevent one of the most common penile disorders in men over 40. Now we've reached what I believe is the most important factor of all, and that's your lifestyle. So much of male sexual health is assumed to be a mystery, controlled by age, genetics, or luck. But in reality, the way you live your life every day plays a powerful role in how your body performs, both in and out of the bedroom. This brings us to tip number 5. Take care of your overall health because it is directly connected to your sexual performance. Let's begin with the basics. Erections are not just about hormones or mood. They are vascular events. They depend on healthy blood vessels, proper nerve conduction, and balanced biochemistry. When you eat foods high in refined sugars, processed oils, and inflammatory ingredients, you're not just harming your heart, you're damaging the fine capillaries that supply blood to the penis. When you skip exercise, sit for hours without moving, or live in a constant state of stress, you're constricting blood flow and limiting the production of nitric oxide, a compound crucial for the dilation of blood vessels during arousal. Then there's smoking. If there's one thing I could erase from every man's routine, it's cigarettes. Tobacco is a proven risk factor for erectile dysfunction. The chemicals in cigarettes damage the inner lining of blood vessels, harden the arteries, and reduce circulation throughout the body, including to the penis. In fact, studies show that male smokers are up to twice as likely to suffer from erectile issues compared to non-smokers. And that risk doesn't go away until you stop. So if you're serious about preserving your performance, it's time to cut smoking out entirely. Alcohol is another one. While a small glass of red wine now and then might be harmless, regular or heavy drinking acts as a sexual depressant. It lowers testosterone, impairs nerve signaling, and disrupts sleep, all of which negatively impact arousal, erection, and orgasm quality. Chronic drinkers often find that their libido fades and their erections become less predictable or less firm. Moderation is key, but the truth is, the less alcohol you depend on, the better your sexual system will function. Now, let's talk about stress. Emotional and psychological stress is often underestimated, but it's a silent killer when it comes to sexual health. Chronic stress increases cortisol levels, lowers testosterone, and keeps your nervous system in a state of alert, the exact opposite of what you need for sexual arousal. Intimacy requires a sense of safety, openness, and relaxation. If your mind is racing with work worries, social anxiety, or internal pressure to perform, it becomes incredibly difficult for your body to respond naturally. Exercise is your best defense against all of this. Just 30 minutes of moderate activity per day, walking, cycling, swimming, weight training, can improve circulation, boost testosterone, enhance mood, and reduce stress. It's not just about looking fit, it's about maintaining the biological systems that power your sexual function. Combine that with 7 to 8 hours of quality sleep per night, and your body will thank you with more energy, better hormonal balance, and sharper focus, not just in the bedroom, but in every part of your life. Now that you're taking care of your habits during the day, let me introduce the final bonus tip, something you can do every single night with zero effort that may help protect you from one of the most common and frustrating penile conditions. Here it is: sleep without tight underwear. This may sound insignificant, but let me explain why it matters. During the night, men naturally experience several erections as part of the sleep cycle. These are completely normal and healthy. They help maintain tissue flexibility, oxygenate the penis, and serve as a kind of maintenance function for your sexual system. But when you wear tight underwear, especially briefs or compression shorts, these erections are restricted, bent, or compressed against fabric and waistbands. Over time, this repeated compression can cause tiny traumas in the erectile tissue. These micro-injuries may not be noticeable at first, but they can gradually lead to inflammation, scarring, and the development of fibrous plaques. And just like we discussed earlier, That's how Peyronie's disease begins. The best way to avoid this is simply to let the body breathe and move freely during the night. Wear loose-fitting boxers made of natural cotton, or better yet, go without underwear altogether when you sleep. Give your body the space it needs to restore itself. So, to recap everything we've covered, keep your penis active, but avoid falling into the trap of masturbation and porn dependency. Prioritize daily hygiene, especially after sex. Never force sex with a partial erection, as this can lead to long-term injury. Be mindful of how porn affects your brain and relationships. Build a healthy lifestyle with real food, regular movement, quality sleep, and zero cigarettes. And finally, protect your nighttime erections by sleeping in a way that allows full circulation and freedom of movement. You don't need pills, expensive supplements, or extreme measures to keep your sexual health strong. What you need is knowledge, consistency, and respect for your body. The sooner you take action on these principles, the more likely you'll enjoy a lifetime of vitality, confidence, and connection. If you found this helpful, please feel free to share it with someone who might benefit. Sexual health isn't something we should be ashamed to talk about. It's something we should be empowered to protect. Until next time, take care of yourself in every way that matters.